If you take your blood pressure medication with your morning coffee, you need to pay close attention to what I'm about to tell you. If you take your water pill later in the afternoon, the same applies. And if you've ever doubled your dose because you forgot to take it earlier, this message could be one of the most important things you hear today. What I'm about to share is information that many patients never receive when they pick up their prescription. It's not because doctors don't care. It's because there is often not enough time during a routine appointment to discuss every detail that can affect how well a medication works. Yet some of these details can make a meaningful difference in your health. One of the most common mistakes I see involves timing. People take their blood pressure medication every day, but they are never told that when they take it can sometimes be just as important as taking it at all. In some cases, poor timing may reduce effectiveness. In others, it may increase side effects or leave certain parts of the day less protected than they should be. Stay with me, because one of the timing mistakes I'll discuss surprises almost everyone who hears it. I'm Dr. Sofia, and I created this channel because patients deserve clear, practical information about their health. Blood pressure medication is among the most commonly prescribed treatments in America. Millions of adults rely on it every day to protect their hearts, kidneys, brains, and blood vessels. Yet many people are told what to take without receiving detailed guidance about when to take it, what to avoid around it, or what to do if they miss a dose. That gap in knowledge can create unnecessary problems. Let's begin with a group of medications prescribed to millions of Americans every year: ACE inhibitors and ARBs. These include medications such as lisinopril, ramipril, losartan, and valsartan. For years, many patients were routinely instructed to take these medications in the morning. It became standard practice. However, researchers later began examining whether bedtime dosing might offer advantages for some patients. Blood pressure naturally follows a daily rhythm. During sleep, it usually decreases, and then it rises rapidly in the early morning hours. Doctors sometimes refer to this as the morning blood pressure surge. Interestingly, some studies have suggested that taking certain blood pressure medications at bedtime may help provide stronger coverage during those vulnerable morning hours when heart attacks and strokes occur most frequently. Other studies have shown less dramatic differences, which is why experts continue to debate exactly who benefits most from bedtime dosing. The important point is not that everyone should suddenly switch their medication schedule. The important point is that the timing may deserve a conversation with your healthcare provider. If you've been taking your medication every morning for years, ask your doctor whether bedtime dosing would be appropriate for your specific situation. Another timing mistake involves something many people consider healthy: grapefruit. Grapefruit and grapefruit juice contain natural compounds that can interfere with the body's ability to process certain medications. These compounds affect an enzyme known as CYP3A4, which plays an important role in breaking down various drugs, including some calcium channel blockers used for blood pressure control. When that enzyme is blocked, medication levels can rise higher than intended. In some individuals, this may increase the risk of dizziness, lightheadedness, swelling, or excessive drops in blood pressure. What surprises many patients is that this effect doesn't disappear immediately. The interaction can last for more than a day after grapefruit is consumed. That means drinking grapefruit juice one evening may still affect medication taken the following morning. Not every blood pressure medication is affected, but enough are that it is worth asking your pharmacist or physician directly whether grapefruit should be avoided with your particular prescription. Now let's discuss a mistake that affects countless older adults every day. Diuretics, often called water pills, help the body eliminate excess fluid. Common examples include hydrochlorothiazide, chlorthalidone, and furosemide. These medications can be extremely effective for controlling blood pressure and reducing fluid retention. The problem occurs when they are taken too late in the day. Many people forget their morning dose and decide to take it in the afternoon or evening. Others simply were never told that timing matters. The result is predictable. The medication begins increasing urine production right when the body should be preparing for sleep. This leads to repeated trips to the bathroom throughout the night. At first glance, that may seem like a simple inconvenience. But for older adults, the consequences can be far more serious. Getting out of bed multiple times during the night increases the risk of falls. Blood pressure naturally shifts when standing, and poor lighting, fatigue, and reduced balance can create dangerous situations. A nighttime fall can result in fractures, hospitalization, and lengthy recovery periods. For that reason, most healthcare professionals recommend taking once daily diuretics in the morning whenever possible. If a second daily dose is required, it is often best taken earlier in the afternoon rather than late in the evening. Of course, always follow the instructions provided by your prescribing physician. Next, let's talk about a combination that millions of people use every day without thinking twice: blood pressure medication and coffee. Many patients take beta blockers such as metoprolol, atenolol, propranolol, or carvedilol shortly before drinking their morning coffee. While this may not create major problems for everyone, it's worth understanding what happens inside the body. Caffeine stimulates the nervous system. It can temporarily increase heart rate and blood pressure. Beta blockers are designed to reduce the effects of that stimulation by slowing the heart and reducing workload on the cardiovascular system. In simple terms, one is encouraging stimulation while the other is working to limit it. For many healthy individuals, the impact may be modest, but for some people, especially those with certain heart rhythm conditions, this combination may contribute to palpitations or feelings of an irregular heartbeat during the period when caffeine reaches its peak effect. This doesn't necessarily mean you must give up coffee. However, some healthcare providers recommend allowing a short gap between taking a beta blocker and drinking caffeinated beverages. Even waiting 30 to 45 minutes may help reduce potential interactions in certain individuals. Finally, let's discuss the mistake I see most often. A patient forgets to take their medication. Hours later, they remember and begin to worry. To compensate, they decide to take 2 doses at once. This can be risky. Different blood pressure medications behave differently in the body. While some missed doses may be handled safely, others should never be doubled without professional guidance. Taking extra medication can cause blood pressure to drop too quickly, leading to dizziness, weakness, fainting, or falls. There is another version of this mistake that is surprisingly common. Some patients prescribed medication twice daily begin taking it only once daily because it is easier to remember. Over time, they assume everything is fine because they feel normal. Unfortunately, blood pressure can remain elevated without causing noticeable symptoms, which means important cardiovascular protection may be lost without the patient realizing it. In general, if you miss a dose, the safest approach is to follow the instructions provided with your medication or contact your pharmacist for guidance. In many cases, if it is close to the next scheduled dose, skipping the missed dose and returning to the regular schedule is recommended. Doubling up without advice is usually not a good idea. Before we finish, I want to make one thing absolutely clear. Blood pressure medications save lives. Decades of research have shown that controlling hypertension reduces the risk of heart attack, stroke, kidney disease, heart failure, and premature death. This video is not about stopping medication. It is not about creating fear. It is about understanding how to use these medications as effectively and safely as possible. If you or someone you care about takes blood pressure medication, there are 5 questions worth asking during your next appointment. Should I take my medication in the morning or at bedtime? Are there foods, supplements, or beverages that could interfere with it? What should I do if I miss a dose? Is there a specific time of day when my blood pressure tends to be highest? Are there any interactions between this medication and the other prescriptions I take? Those simple questions can lead to valuable conversations and help ensure that your treatment plan is working exactly the way it was intended. If you found this information helpful, consider sharing it with a friend or family member who manages high blood pressure. Sometimes a small adjustment in timing or awareness can make a meaningful difference. I'm Dr. Sofia, and my goal is to help you understand the health information that often gets left out of the exam room. Thank you for watching, and I'll see you in the next video.